My name is Rashmi Halker Singh, and I'm the deputy editor of the Headache Journal. I'm joined today with two of the authors of a recent publication called Beyond Pain Control, Outcome and Treatment Preferences in Pediatric Migraine, Dr. Matthew Khayata and Dr. Monica Lemmon. Welcome. I'm so happy to have you join us today. I was really interested to read this manuscript. I think migraine in the pediatric and adolescent population is really important to discuss. Your manuscript was really interesting to me because of a few different things. First of all, we know that migraine impacts 1 out of 10 adolescents and children, and this is a critical time of life, given that this is a critical stage of learning and social development and time that we can never really get back. And I think the data that you uncovered was really interesting and pointed out several important things that we can discuss. So without further delay, can you please summarize your study for all of us?
Absolutely. Thank you so much, Dr. Hawker Singh, for this amazing opportunity. And yes, we feel this is important work. And you're right, migraine is really common. And I think it might be under-recognized in the pediatric population how common it is and the impact that it has both economically and just personally for the patients and their caregivers. We sought out to understand more or understand better what outcomes and treatment preferences that were most important to children, adolescents, and caregivers who have migraine. We know that there's comprehensive guidelines out there that have been published to better improve the quality of acute and preventative clinical migraine trials. And the outcomes and endpoints that are recommended are all based on expert consensus. They're extremely valuable, but they may not truly capture the true burden of migraine nor be fully accepted by the stakeholders. And we wanted to learn more about that and see if that was true. So we recruited patients from a pediatric migraine registry. This is a multi-center prospective registry of children and adolescents ages 4 to 18. And these participants were enrolled from 19 sites in 15 states within the US. We actually, we completed semi-structured interviews with participants and caregivers. And we selected 30 dyads and completed 59 interviews. And during these interviews, we asked participants, both the patients and their caregivers, to reflect on outcomes that matter most to them, specifically pertaining to acute and preventative medications. And through those questions, we were able to understand better what mattered most to them, and those individuals were able to describe that to us. And through that information, we were able to identify themes and sub-themes, which we further discussed in our paper.
So what were some of the results that surprised you? Did you find anything that was unexpected?
So in terms of, I don't know if truly unexpected, but I think, in terms of, for example, acute medications, when describing what features were most valued in acute medications, participants often cited a reduction in pain severity, which they characterized as either pain resolution or reduction in pain intensity, as well as a real value for the absence of side effects. And they also valued medication attributes. For example, specific routes of administration or taste of medications. Those were extremely valuable for participants. Preventative medications were a little bit similar. Participants often cited the absence of side effects, a reduction in headache intensity, which they characterized as pain resolution or reduction in pain intensity. And then other things they valued were reduction in headache frequency, the medication attributes as well, And probably the most interesting, in my opinion, improvement in non-pain symptoms. Participants spoke a lot about non-pain symptoms, including nausea, emesis, dizziness, photophobia, all of the things that we know are typically associated with migraine, but may not really be understood. This was coming from, in terms of, from the patient's perspective, they really felt that those things were extremely important to them. So I don't know if that's truly unexpected, but that was an interesting finding to us, that patients, seem to value the outcomes and endpoints that are out there and that are traditionally expected or accepted, but they also value things that are not being studied very well yet. And we hope that we hope that our research will promote.
Well, I think you're absolutely right. I am an adult headache neurologist. In addition to that, I'm also the parent of an adolescent who has migraine. I have a 16-year-old daughter who has migraine, and I work very closely with her headache neurologist to come up with appropriate treatments for her. And it's really interesting to me to have this dual role as both a caregiver of someone who has migraine and also as a migraine specialist. So that's my day job. And also it's a different, a cat there that I carry at home. And I had a recent experience that resonated with your manuscript, for example. So I went home and I talked to my daughter about, a treatment that her neurologist recommended. And the first comment that my 16-year-old daughter, who has missed a little bit of social activities and different things because of her migraine, said to me is, "What are the side effects of this treatment?" I was taken aback by that statement because I know the impact migraine has had on her quality of life. I know the impact the pain has had on her quality of life. Yet the first comment she wanted to know is, what are the side effects that would have, the potential side effects of this medication? Which is a common question that my adult patients pose to me about medications, right? So we have to think about these patients, these adolescent patients, in a similar fashion. They're independent decision makers too. They know the impact that their disease has on their quality of life. We also know that 1 out of 10 people who have migraine, 1 out of 10 adolescents who has migraine is not insignificant, and it is a critical phase in their time that they can never get back, that has lifelong consequences if we don't treat it. And so we have to act quickly because it can change the course of their life if we don't. And yet they're also thinking ahead about medication side effects and these things that you're talking about. I really was interested in your manuscript because it really has a patient-centric approach that we should take into account. So I thought that was really interesting, and the things that you're bringing into account are really interesting because I think it brings the patient voice into the forefront. So I really appreciated that. What are some of the gaps that you think that we should think about from the findings that you were able to uncover from this manuscript?
Yeah, that's a great question. I think some of the most important things to take away from this is that, again, the traditionally accepted migraine endpoints and outcomes are extremely important, and our participants certainly agree with those things. But they did endorse other things that, that are important as well. And I think moving forward, we need to keep those things in mind. One of the biggest takeaway points is that many of our participants, unfortunately, found it extremely hard to imagine any sort of relief from migraine pain. They describe this kind of constant debilitating pain. And from that, we can take away that, there needs to be more sustained investment in developing treatments to try to improve this outcome and others for these young people with migraine. I think that's the biggest takeaway in my opinion. Dr. Lemmon, you can chime in if there's others, but ultimately, we feel like there's a major opportunity here to design patient-centered trials, develop drugs, support product labeling that are in alignment with outcomes that matter most to children and adolescents and their caregivers, with the hope that, we'll develop future therapies that better meet the needs of the stakeholder. In the future, I think better understanding this experience that these patients are having is extremely important. We touched a little bit on that in this paper, but I think really digging deep and asking more targeted questions to truly understand what it's like to have a migraine and go day by day is very important. Because that information may identify additional outcome measures that are very meaningful to stakeholders and help us as the clinicians and the researchers better help them. We have a manuscript outlining this actually, and it's in preparation. So hopefully we can help, in addition to this work, help kind of lead the way with some more things that can help these people.
Awesome. Well, thank you so much for the work you're doing. I can't wait to read that manuscript as well.
Thank you so much.
Thank you. It's been a privilege to join.